Okay. All right, good stuff. Good morning, everybody. My name is Mike Iriart. I'm the senior account manager for Proofpoint's healthcare practice here in Virginia. Um, I'm here to introduce a team of experts with a massive amount of experience in cybersecurity and information technology to discuss, as Lee said, creating a cybersecurity roadmap. Before that, I get the privilege to share a little bit of information about my company. My company is privileged to have most of the healthcare institutions in Virginia as our customer. Definitely a cybersecurity company. We're known for email security and data security. We're the Gartner Magic Quadrant leader in email security. Now we have the largest market share out of any provider for data security as well. We're also recognized by Gartner as the customer's choice for data loss prevention. We put about or over 20% of our revenue every year into research and development around cybersecurity. And now we're helping our customers secure their own use of artificial intelligence. So very key, especially when all these discussions that we're going to be having over the course of events this week. So, and now finally, we're also a big partner, Microsoft and AWS. And you can actually buy our services through both of their marketplaces, through both Azure Marketplace and AWS. But now I get to introduce the true panel of experts here, probably with combined between all of them over a century of experience. And I'll first start off with the moderator, Ian Mack. Where are you, Ian? There he is. So Ian is the new president-elect of Virginia HIMSS, and he's also the senior cybersecurity analyst working over there at UVA Health. Real top-notch guy, about as friendly as they come. And then on the panel, we've got Erin Trost, who is the information security manager also over there at UVA Health. And she's also the SIG chair for HIMSS Virginia, and got a wealth of experience. She can tell you some stories. We also have Paul Carrillo. Paul is the Chief Information Security Officer for Inova Health. Really good to have him down here. First time to have some real big presence from Inova. And Paul's got 25 years, probably more of healthcare experience. He's rebuilt Inova's cybersecurity program and operations. He's established the information assurance team. He's working advancing identity and access management. And he's a decorated field grade officer with 38 years of service. This man is one of the few people I know who's actually worked his way up from private all the way up to lieutenant colonel. A massive accomplishment right there. Paul is a member of U.S. Cyber Command as well. And again, massive amount of experience to bring to this panel here. We've also got Brady Miller. Brady is the new Chief Information Security Officer for Carilion Clinic. And he's got more than 20 years of cybersecurity experience. And he's been working in healthcare for a long time, as well as a veteran in the U.S. Navy. So thank you, Brady, for your service. And he previously served as the deputy CISO over there at Methodist Lebanon down there in Memphis, right? So Brady's another super expert to have up on the panel. And then finally, Trip Humphrey, who actually I just got to see down at the Roanoke InfoSec event, talking about security in artificial intelligence. Real smart guy. He's director of data science and AI at Carilion Clinic. He's got over 20 years of experience as well. Got his own consulting company, and he did a lot of time over there at Bon Secours. So again, real good panel of experts we got up here. So guys, come on up and enjoy the comfy chairs. So thanks again for the time.
Okay, can you hear me? All right, excellent. Well, welcome everyone to the most vital conversation you've had all week, Monday morning. So I was pretty confident in that statement. Take a moment and look around the room. Everyone here is part of the digital revolution, the famed digital revolution, right? And that revolution isn't a stroll through the park, is it? It's moving at light speed, warp speed, if you're a Star Trek fan. And we're constantly battling that balance that we're trying to strike between innovation and agility and security and compliance. And that's a tough balance to strike. Our adversaries are no longer just, people hidden down in their basement, isolated hackers. No, they're well funded, well organized, and are constantly looking to exploit the gaps that are between what we build and what we protect. It's not just about firewalls anymore and threat detection. No, it's about culture, capital, and continuous improvement. So today we have 4. We added one. So Trip the last minute addition here. So you didn't make that. Sorry, buddy. Okay, yeah. But 4 esteemed colleagues, security leaders in each one. And they are constantly fighting the day-to-day things such as securing buy-in from leadership, fostering a security mindset, and then building that roadmap from beginning to end, one that doesn't just react to threats, but actually anticipates them. So let's jump right in. Thank you all for being here. And Paul, I'm gonna put you on the spot first. So I'm gonna jump in and just ask the first question here. And that is,
all right, let's do it.
You ready? All right.
Let's do it.
So what are the biggest risks for your organization today and how are they evolving?
All right, so hands down, the number one threat for American healthcare, American critical infrastructure healthcare, is extortion. We are vulnerable. The threat actors know it, and they've been coming at us year over year. You look at the graph, starting, you pick any year, but year over year, that line is higher and higher and higher, and it's still going up. Even this quarter, it's still going up. So that is the number one cyber threat that we're actually facing, is extortion. Forget about nation state. We're not funded enough to be able to thwart that anyway, and we really need our friends over in the agencies for that. But there are other threats. We have emerging technologies. We have I wouldn't call it a threat, but challenge with innovation, right? So these are all areas that we need to be concerned with. But the number one is extortion, I would say.
Aaron, you have the other mic. Push up.
Now is it on? Okay.
Yeah.
All right. Yeah, we'll just rotate then. So going off of what Paul said here about extortion, I think one of the things that we continue to struggle with, and we hear this every single year, is around security awareness. So for our employees, that is how we get extorted, right? That is how things get into our organization, is by our employees not knowing what they should and should not be doing. And so one of the efforts that we're really focusing on at UVA Health this year is expanding security awareness, making security awareness is always one of those hard topics, right? Because everybody says, well, cybersecurity should be doing their job. Don't let stuff in. But we rely on the employees to be able to catch things, because we're not going to catch it all. Nothing is going to catch it all. And so educating our employees to make sure that you just stop and ask questions. Like if you see something you're not sure, pick up the phone and call somebody. So I think that's one of the areas that I feel like we still struggle with as a cybersecurity profession, and we talk about constantly.
Right.
I think part of the issue with cyber awareness and training, because Paul did it for a long time too when he was a reservist, but in the military, we do the same thing over and over. Kind of the definition of insanity. You expect it to change when you do the same stuff year after year, and it doesn't change. Getting out as security professionals, even other leaders in the healthcare organization, get out and talk to your people face to face about the training, show them how it affects the organization. or themselves personally. I think that helps. We're trying to do a roadshow at Carillion to do that same thing.
Second question. How can we foster a security first mindset in the organization? Always a tough one. Tell you what, Brady, since you went last, so you go first this time.
It's going to tie back into what I was just saying. Get out and talk to people. If you can show them why security is important to the organization and how it affects them, how it helps them, we're not here to hinder our users. We want to innovate. We want to improve healthcare. Just want to do it safely. So if we actually sit down, have a real conversation, not just say, no, you can't do that. I talk to Trip all the time because he wants AI, because the business is asking for AI. Awesome. What is it you want to do? How can we implement it? And how can we implement it safely?
Right.
I think that's how we
Department of No.
yeah, really build it in, just have those conversations. We're not the bad guys here. You might think we're the bad guys. We're the no police, right? Let's get out of that mindset.
Aaron?
I agree with everything Brady just said. I think one of the things around, especially like AI, one of the things that we've been trying to do is have like an AI governance group where cybersecurity is involved in AI, and we're helping kind of lead that versus saying, no, you can't do it, or let's go back to the table about that later on once we have more of a framework. So we're kind of like boots on the ground trying to get more involved in that and asking the right types of questions. So I think you're right. It's just about like having those conversations with your stakeholders, and letting them know that you're there to help. We don't want to hinder. We don't want to say no, and just kind of having those conversations.
Okay, I guess I'm up again.
Tag.
All right. So yes, indeed, there's a theme here, right? We are not the no shop, N-O. We are the no shop, K-N-O-W. We really want to get out there and circulate, engage, talk with people. We really want to talk about your ideas. Very big fan of innovation. I love innovation. It's, training only goes so far. Training is necessary. We need to have a training program, but it's not just the 2-minute shot or the hour you spend annually or whatever the program is that you have. It's really about those security awareness spots. It's about being present in meetings and talking from a security perspective and providing that input. Making yourself available is probably the key to doing that. And it's not just the leadership, it's everybody on the security team. When I first joined Innova, and actually even into this year, I would still find myself in conversations with other people where they've essentially said, we were told security said no. Well, I've been here now 6 years. I don't think I've ever said no to anything. So it still comes up, and I think it's a crutch. I think it's become a crutch, and that's the thing that we have to kind of engage on and say, well, I don't recall ever saying no, so let's have that conversation.
Got it. So I think I'm going to try not to answer regarding AI, which is hard for me. But I think the things I'm hearing are really about communication and about sharing of information, just lowering the walls, so to speak, not security walls, but the conversational barriers that often happen. I think one of the things that, so before AI was sort of integrated so tightly into what I did, I just ran the data science department. And data scientists have a reputation. If there's any amongst you, keep your hands down to stay hidden from untrusting eyes. But the concept is that data scientists are generally rogue actors with internal, because we have Python, we've got R, we've got Rust code. We're running in many ways dangerous things on our computers, and we can't be trusted for the most part. But I think that I did everything I could with Carillion's security, going all the way back to Rob Perry, to Brady now, and folks on his team, to sort of divest them of that notion and say, like, hey, we want to be above board. Here's all the things we're trying to do. Here's all the foundational elements. We need secrets management. We need containerization security. We need auditing for our Docker containers. I think all those components that we needed, we and maybe historically had not been talked about. But by lowering that barrier and talking regularly, we have a standing meeting with Brady's team every 3 weeks, I think, and we just talk about all the stuff we're trying to do. And it's probably, as long as we present it that way, that we're just keeping them aware and we're not using it as a way to turn the screws on security and try and get things faster. I think it's a healthy relationship, and then hopefully it helps them too. And from that, I've been able to identify some people that are good advocates for AI security, and hopefully we're going to be using them to further that conversation. So I think communication is key.
I think advocates is a great thing to say, because whereas we're cybersecurity, but having ones, it's a mindset for the organization. And so it's not just cybersecurity that's the ones that should have that. It's every department, whether, wherever you are in it. So having those advocates and partners through the different groups as well. So question 3, and Aaron, I'm going to start with you this time. How do you properly balance innovation and agility with security and compliance?
That's a good question. So I think what we were just talking about, right? It's having those conversations not only with the stakeholders, but also with leadership. So I think some of those conversations around cybersecurity, if there's something very innovative that we want to do in a space, we as cybersecurity need to understand that. So what kind of risk are we introducing to the organization? And then we need to work alongside our partners to make sure that we're plugged in and that we're keeping things secure. So I think it's just communication, it's collaboration, and it's working through those challenges of innovation that we have.
Tag.
I don't think it's an innovation versus security conversation. I think it's an innovation and security conversation. And I think we start with what's the value that we intend to bring. AI is kind of a buzzword, and information technology is replete with buzzwords. I think as artificial intelligence continues to mature, we're still going to hear it as a buzzword, but there are serious benefits that can be had from applying that as a technique and a capability to solve problems. I think the conversation really needs to start with what value do we intend to bring? How do we bring that value to the organization, to our community, to the patients that we have the honor to serve? And let's do that in a way that we respect the data, we protect the data. And that's really where the core of the conversation needs to get to. Are the tools somewhat immature to protect that data? Well, they might be, and we need to have a conversation around that, because now it's a risk conversation in terms of value for risk. It's not a well, we don't have security, so we can't do it conversation.
Not a whole lot to add there, but for the risk piece, I think that's the biggest part. We'll identify the risk, whatever you want to do for the innovation. Is it worth doing it and paying to help mitigate that risk?
Right.
It's really up to the
Balance.
business. We're just here to help advise and have those conversations.
Trip, I was going to say, it's talking from almost from the other side. Yeah,
So
it's
I
really
think
important.
helped the most is to stop speaking in the abstract. This is a difficult thing to do because a lot of AI technologies are so multifaceted that you end up having trouble pinning down a single use case. And I used to give, not Brady, but one of his employees a hard time that I felt like I couldn't talk to security unless I had a documented business use case. And it made it very difficult when we're just trying to lay the foundation here. And we've worked through that. But I think when we stop, if we can somehow find a way to talk about the specifics, Paul, you mentioned you've got to map risk to value and figure that out. I think understanding that if a policy needs to exist, or a process or a protocol or procedure, all the P's, if they need to exist, it generally should be done to meet a compliance objective or to meet and mitigate a risk. And if those are definable in such clear terms, then our conversations should follow those same terms. So I think avoiding the abstract and saying we need to figure out this security approach, and instead saying we got to harden data at rest, we've got to encrypt this, and be very transactional in those conversations, it really helps.
Excellent. Well said. 4th question. How can we, as a cybersecurity industry, ensure that our roadmap is adaptable to emerging threats. Brady, let's start with you.
I don't write it as a 10-year plan or a 5-year plan. I write a 12-month plan and I look at it every week. Every decision, every change that comes about, new threat that emerges, look at your roadmap. You may not change it, but you might. Or you might look at the technology that you thought you were going to use, implement on that roadmap. You know, kind of need to pick a different one and try and kill two birds with one stone. So I probably look at it at least once a week nowadays. But yeah, I never go longer than 12 months.
Aaron?
Yeah, I agree exactly with what Brady said. So I think we try to do a 1 and a 3 year roadmap. And I can tell you right now, most of the time, what you think you're going to be doing in 3 years is not what you're going to be doing in 3 years. Sometimes we don't even know week to week. You know, it just depends on what's happening in the industry, and you know, kind of like evolving from that. So I think 1 year, I think we look at that weekly. I think it's something that we're always looking at. And then the other thing that we also need to do is allocate the resources to be able to do that. So when we're building a roadmap, we can't just say, okay, well, we want to do this in 12 months if we don't have the resources to do it in 12 months. So we have to figure out that resource component along with what is that emerging technology that we want to implement.
I guess I'm next.
Yep.
I actually I look at this a little differently. I bifurcate threats from planning. Threats are those things that are going to frustrate your planning and your strategy. So you have to account for those, and you need to be ready to adjust your plan to that. But I think more in terms of doing long-term strategy planning in terms of where the organization wants to get to and supporting where the organization wants to get to, whichever organization you happen to be working with. And you'll have annual plans and initiatives to try to get there. For healthcare, it's a lot of it centers around data protection. You know, as the organization is seeking to improve community health and improve outcomes, our patients are very much concerned about where their data goes and who has their data, and did their data get offshore, or do the bad guys have their data? That's a persistent concern. Now, in terms of threats, those threats are going to come, and they might be cyber actors. That tends to be the one that we have to deal with the most. But there are other threats. Emergent technology is actually a threat. Artificial intelligence doesn't come with a whole lot of controls yet, and we need to figure that out. So it is indeed a threat. It's a cool thing. It's a thing we should be doing. But we need to account for that.
So I've been trying to find the opportune moment to bring in a topic that I spoke on in Roanoke, and I think this is a good one. But I think, and this is almost a sub question to this, is AI and some of these emerging technologies are often treated as things on that roadmap to deal with. But I wonder if there are also things that should be going into the vehicle itself, help move you down that roadmap. And I think we so often talk about AI, especially. I certainly hear it a lot, that it's a risk, it's a threat, but it's also a shield. Like, there's as many AI technologies coming out for the white hats of the cybersecurity world as there are. And the main issue is that while we have governance councils and we have security procedures, I promise you that the bad actors don't, right? They're working at breakneck speeds. And so I wonder if they're willing to throw on any sort of engine to their car moving down the roadmap. And should we be doing some of the same things? Not necessarily with the same reckless abandon, but we've got it. I think there's a sense we've got to move faster. Does that influence your? I like the way that you separated incidents and or sort of threats and planning.
I would agree with you, Tripp, that artificial intelligence is a tool and a capability that we should be leveraging, not to reckless abandon, obviously. But we should not be ignoring it. To ignore it means we're going to end up being laggards on that curve. You really want to be kind of in the center of that curve, really, if you're truly conservative. But leaning a little bit more forward on that curve is, I think, a little bit better. in terms of seeking advantage from that technology, the offer that technology has to improving better outcomes, better solutions. In terms of using that technology full spectrum, we absolutely use artificial intelligence in my shop. We absolutely use it. It's baked into our tools. Epic has it built into the tools, right? So we're using it there. So it's a tool, it's a capability. Just because it's emergent doesn't mean we shouldn't use it. We should use it and think about where we want to use that. In terms of data protections, there are certain things we can do, certain things we can't do organic to artificial intelligence solutions. For those areas where the capabilities are not organic to the solution, then we have to talk about the ring of controls around that in terms of the level of protections that we need. And that's true with any emergent technology. Actually, that's true with any legacy technologies as well. Same approach.
Number 5, what is the best approach to providing justification for cybersecurity investments to executive leadership and the board, or the board?
All right. So before you go ask for money, know what it is that you're wanting to do. Ensure the landscape is well understood. If you're whether it's the board or the CIO or wherever we have to go for money, and that's true for just about anything. Before you go and understand the landscape and ensure that the people you're communicating with actually also understand the landscape. And this isn't, a call for warmongering and scaring people. This is really, what are we actually facing? I talked earlier about this. I said extortion is the number one thing that we have to worry about. And my boss, Matt, asked me, he says, well, how do I spend less on cyber? I says, well, that's easy. Can you restore the environment in 4 hours? Because I would say you probably need to spend less on cyber then, because you can restore the environment pretty quick. Does anybody know the average? I'll answer it. You don't have to answer it. But, rhetorically here, does anybody know how long it takes a health system actually recover from an extortion event? It's 8 to 16 weeks. Weeks. That's a long time to be without the digital environment. Yes, parts of it come back soon-ish, 72 hours, a week. Some of the legacy stuff won't come back at all. That's scary. So understanding the landscape is the first piece, and then understanding the attack surface, the second piece. Now you're ready to go formulate solutions and then ask for money, I think.
I'll agree that stay away from the Chicken Little syndrome, as I like to call it. Everybody's old enough here to remember Chicken Little, I think. Fear is a good motivator, but only if you really, really, really need to use it. Otherwise, stay away from it. But once you understand that and you're ready to ask for money, if you can tie, and I'm trying to put in an IGA solution this year. Business has tried to do it over the last few years. They didn't want to. It's expensive, right? Everybody knows, something like SailPoint or what. They're super expensive. Tie it to an efficiency, or how can it improve the business at the same time? If it's there, don't make something up. But there's an efficiency that we can get the doctors working faster, making more money for the business. If that's an extra tie-in, use it, because that'll help.
This is fascinating because I think I sometimes remember that Brady is the one that helped me launch ChatGPT Enterprise at our institution. And while I think I'm almost going to play the foil to what you're saying, not that I disagree, I think we do need to advertise those things for the security features. But I took a strategy where ChatGPT Enterprise is a product that has many different use cases that it was difficult to articulate. Like, what's the value add? What's the efficiency? And I was like, let's stop talking about value add and value efficiency. This is a risk mitigation strategy. So I was almost putting on the risk mitigation while he's selling. That's funny to think about it that way. But we had users who we knew we couldn't stop them from getting to these tools. No amount of firewalling would keep people away. They're going to find a way. They'll be used on their personal phones. And so it became a concept where if we could implement a solution that allowed them a safe alternative, then that was the prevention. What's the ROI? I don't necessarily know how to quantify that. No one does, by the way. If they tell you they do, they're not telling you the truth. So there's a lot of value proposition there that's just risk mitigation. We can prevent a breach if we're using it in a secure environment. So I think it's interesting to and I talked that up to Brady's help getting that through. So anyway, I think it's valuable to attack it from both sides.
Excellent. And great job. No one gave away any state secrets of how you really get money. And so good job. You didn't incriminate yourself. If your bosses are here, nice job. So the final one, and we've actually touched on it already, and that is how often should we revisit the roadmap? Aaron, do you want to start with?
So I think it's continuous. I don't think we ever stop revisiting. I think we're always looking at our roadmap and seeing where we need to make changes. And I think also prioritizing, because one thing that we may think is a priority today is maybe not a priority tomorrow. So I think it's a constant effort that you're always looking at it. You're always thinking about what is the next thing we're going to be doing. And then just modifying your roadmap and working with leadership. I think that's the other important thing, is if your roadmap does change, you need to make sure that your leadership knows what's happening and why. So it's having that conversation.
I don't really have much to add to what we've already talked about there. I mean, it changes every day, but for sure, take a good look if the business strategies change. Make sure you take a really deep dive at it. It's not a cursory glance. Make sure you're staying in line with the business. That'll help you in the long run.
I'm going to chime in before I let Paul have the last word because I want to tag on to that. But I don't do the road mapping, but I think I more than think. I know that I run the AI steering committee at Curly, and so one of the things that we discovered in that process was we had just an outright admission, and hopefully this isn't dirty laundry, but we were told by our policy creation team that we can't reevaluate policies this fast. We can't constantly reassess legal documents and regulations at the pace you're asking us to do this. And so I think what that sounds like to me is that not only do you need to just make a focus of looking back at it continuously, but you might need to reevaluate the underlying mechanisms that allow you to create policy to manage risk at their core level, that if you can't make the engine run faster, it doesn't matter how many times you're revisiting the roadmap.
That's really interesting. I'm glad you actually mentioned that. For our organization, and it's tough doing this, but quarter of the policies every quarter get reviewed. It's a tough cadence, but I think it's necessary. Even if we make no change, it's still a review. It's still an opportunity for change, and it's an opportunity to solicit change, because a lot of people have a lot of ideas. And unless you solicit those ideas through some sort of cadence, you're not going to get those. You'll get the ideas in a crisis. And that's the wrong time to get the idea, because I don't have time to write it down. I'm not going to remember it. So the cadence is important so that we can get on this cadence. I think in terms of strategy, whether it's a 3-year, 5-year plan or 10-year plan, I think, and this might be a little aggressive, but looking at that at least twice a year, looking at it, review it, look at it, take a half a day, just look at it. And as the business changes, use that as a trigger as well and look at that. When it comes to the annual plan and any initiatives that we're running, I think a quarterly review is really necessary just to make sure it's on track. Otherwise, it may just spin off and become a forever project, right? And we don't want those. Those have diminishing value as they're running, right? To the point where it's negative value. So I think for those, at least a quarterly review, just to understand where it's at. And it's not that I have to do the review, at least for my initiatives. It's whoever I've given that initiative to drive that initiative needs to have a conversation with me about where it's going and what obstacles we happen to see. We may have to make adjustments, or we may have to stop it altogether.
Questions from the audience. First off, thanks everyone very much.
Thank you.
Great answers. Let me stand up so that I can see the other half of the room. And do we have, you're good. Okay, we got a microphone. Question?
Hey, good morning. Great information. Thank you, everyone. This is a two-part question. So talking about the kind of ongoing planning and the asking for funding and the kind of looking at a 12-month iteration of a budget for your team, have you had the opportunity to kind of inform that ask with the new constraints that are going to be put in, especially the not-for-profit healthcare systems, as the OBA can kind of goes into being live, and the constraints around the financial impact that that's going to have on health systems in general? And then second to that, when you are working with the finance team in asking for those funding requests, are you also helping to inform the finance team on the cybersecurity insurance protection needs around the organization?
Everyone speak at once.
Who will go first? All right. All right. I'll start with the insurance one. You have to remind me on the first one. Finance really, our finance at least, really doesn't really care about the insurance piece at all. Insurance, of course, cares about the insurance piece. And it's prudent for us to have some level of insurance so that we cover our liabilities, we cover our concerns. Now, for the first part, what was that again? Got it. Yes. Headwinds. We're all facing some pretty significant headwinds. I don't think I've ever gone into a budget cycle, and I'm still relatively new to this, and I don't know, you've probably done more budget cycles than I've done. I don't think I've ever gone into a budget cycle where they said, "Hey, go ahead and ask for more money." It's usually find 20% or more to cut out of your budget and figure out how you're going to keep the same level of capability and value for the organization. Those are tough conversations. So I usually enter those conversations with my boss and his boss. Where do we think the landscape is going to be going, and what level of protections or attack surface reduction? I talk attack surface reduction quite often. Do we really want to engage in? Because if we really do need to cut the cyber spend or the compliance spend, that means our risk is going to go up and insurance might become more expensive and we may have more security incidents. Not that we couldn't handle them. I think we can handle them, just that we will have more of them that will affect our reputation, that will shape our patients' confidence. Are those things that we are willing to take on in a constrained environment? We might have to. We might not have a choice, but those are the conversations that we have. And the decision on, do we keep the spending level, at least level, while we take cuts elsewhere? That might be a conversation, but I think it's worth having the conversation. And if we are going to have more risk, well, then I'm probably going to have to adjust things and ensure that I have a even better incident response capability, because, well, we're going to have more of them.
In an effort to just try to get as many questions in as possible, does that answer yours? I was gonna say, well, maybe we'll do one, and then if we're kind of close on time, so that's where I want to. Any other questions? One in the back, one right here.
The story from me person so that I get to run like Trip did.
Lee's getting a workout for the steps in.
So we're kind of in the infancy of the AI age. That's just the way it is. And quantum period is coming. So with that kind of mindset, horrifyingly enough, can we even get ahead of it as health system? Like, do we collaborate with AI researchers and security systems, or are we facing like national or international cooperation?
So I'm asking, or I'm going to try and answer as not the security professional, but and this is not specifically to Carillion either. I don't think the healthcare industry is primed to do well at what you're posing in our current format. I think it sort of speaks to the same budget. We have often avoided sort of gold mines of opportunity because of the risk they pose, and now we're going to we're going to be forced into a position where we have to look at the lesser of risks. It's like, well, you might not be ready to accommodate AI. You might not be ready to accommodate quantum to the level we need to, but you're going to have to do something more than nothing. And I think that's the only way we're going to do it. I think you also have to aggressively recruit new talent, because some of the people who are doing the best work in this space, from what I've seen, are not even out of college yet. And so I think that that is an aspect that we have not historically done well at as an industry. I think Carillion is doing well. We partner with a lot of institutions, but I think as a healthcare industry, I don't think we're where we need to be. Brady, did you want to?
I mean, I'll add in just a little bit, but you know, with the development of AI, and we know quantum is coming. What year that will be, where it's really scary for us, is still kind of yet to be determined. But I think it's sooner rather than later. But I look at my team at Carillion, or even the team I had previously, or my military team. Nobody's really ready for it unless you've been doing it for a couple of years. You're in college, and we need to hire for it. I don't have the skills for it on my team.
I'll add very, very briefly.
Yep.
I don't think we really need to worry about quantum because we still have TLS 1.0 and I think some SSL out there. So I think if we take care of the basics and start improving there, then maybe we have a shot at dealing with quantum at some point in the future. Just say it.
Solid.
And I said that was the last thing. But there's a
Last.
sorry, am I in trouble already? Too bad. All right, take the mic from me. So I think we have a bad habit of only looking at the risks without looking at some of the advantages. So there's like the sword and the aegis and the sword type concept, where we don't know yet all the benefits that quantum will show us. And so some people like frighteningly don't want to talk about quantum because it's quickly going to undo all of our encryption methodology. We don't necessarily know all the new encryption methodologies it's going to introduce yet. And I think that's when you only look at the dangerous side, it is scarier. But there's a lot of opportunity in these technologies that often go unmentioned because they're just not as sexy to talk about.
How do you guys foster a relationship with your operations team, infrastructure, EHR, apps? I think it was Paul that said he wants to be a KNOW team and not an NO, which leads to the perception that cybersecurity is only an NO team.
Yeah, that's hard. And thank you for asking that. I stepped right into that when I joined Inova, and I have dealt with it every organization I've been in. It's really getting close with the infrastructure folks and diffuse the idea that you're a threat to their job security, or the things they're trying to get done every day. I advocate very strongly that, hey, look, I'm trying to help things go smoother for you. You hate doing security patching. You know you need to do it. Why don't you get an automated system? And I'll stand there elbow to elbow with you and say, yeah, you guys need the money for this. You absolutely need this because you need to do it. I can talk about our attack surface all day long. I can talk about the millions, yes, millions of vulnerabilities that exist in our environment. But if nobody's doing anything about them, then I'm wasting my time. So really it's partnering with the infrastructure folks and letting them know that they have an advocate to get the things they need. We could not take down our core switches. I don't know, you probably have the same problem. We could not take down our core switches in our environment because, well, they needed to be available for surgeries and for the ER. Well, we take them down now because we have to patch those. They were so riddled with holes that it wouldn't have taken much for a threat actor to just knock one of those out. Now it's a lot harder, but we do take them down. So it's partnering with infrastructure, I think is the sweet spot in terms of helping them do the hard things that they're trying to do every day.
Yeah, and I was just going to add, you have to be willing to sit at the table with them. So you can't dictate the infrastructure what needs to be done if you're not willing to sit down at the table and help them figure it out.
You like that answer.
And see it from their side, where they're coming from. Any other questions?
I have a really quick one, if I may.
You have the mic.
microphone gets to ask questions. So keeping up to speed on the millions of threats and the attack surface and all of that, will you each share just really quickly your favorite place that you read, listen, micro learnings, communities that you stay in touch with so that you are well informed on these subjects? Help those of us that have 2 minutes to give to this once in a while.
My homepage is set to the Hacker News.
Hacker News. Is
Yeah,
that what it's
but
called? Hacker
All the
news. All
hacker
right.
news. There's a lot of sites out. If you more for a professional organization, HISAC, which is a phenomenal organization for threat intel, specifically for us.
Yeah. Sorry. I was going to agree with that. HISEC is one of my feeds. US CERT is great. So we get lots of alerts from US CERT. That's usually where we find vulnerabilities really quick in our organization is by feeds like that. So just staying plugged in, and HISAC is a membership, but you also get the community is involved, and so when they see something in their environment, they'll also let you know, and so that way you can stay plugged in.
So, as an intelligence officer for almost 4 decades, I don't really have a single source. HISAC's a good one. There are a lot of good ones. I actually keep a pretty broad spectrum of inputs, including personal contact. I'm very tied in with the agency. So if you've not made friends with your local FBI office, go do that pronto. You want them to be friends before you have a problem because they can help you. DHS runs in regions. You want to connect with them as well because they can bring some help as well. But certainly peers, CISO community is very strong. We chat almost constantly now, I think, on Signal amongst the various groups. So it's just this constant influx of information. And if there's something important, I can kick it over to my team to take a look at it and give me a brief on it later in the day.
Come on, Trip. You've got a podcast or a favorite thing that you keep up to date on the opportunities of AI. I'll even switch up the question for you.
So from an AI standpoint, it's hard not to read about AI. I would say you can just look anywhere in this room actually and see the words AI probably at some point. There's a lot of really good. I mean, I don't even know how to pin one down, to be honest. I just you breathe it in, but I read a lot of the industry news. I read Becker's Scottsdale Institute. I read HIMSS publications. That's often what I find I need to do more than learn about the underlying technologies. There's piles of journals that my team shares with me and that I share with them that stack up. And so a lot of what I learn about the technology of AI is from journal articles, which unless you've got a real tolerance and don't sleep easy, I would say it's not the best way to get cutting edge news. But the Becker's, Scottsdale, those types of publications, those are really good for helping to frame what my leaders are thinking about, what they're hearing about, what their questions are. So Harvard Business Review, MIT Technology Review, like all the things that they'll consume really help put the technologies I understand in perspective for what the healthcare is going to care about. And then I had a question, I guess, is TikTok not a good place to learn about security risks?
Oh, please go right ahead.
Just kidding.
Any other questions? I think we are at time, and I don't want to keep everybody from lunch. So that's always the most important right after, right? So thanks everyone. Thank you all for for a wonderful panel, and give them a hand for